Good morning. We're pleased to announce today that in working with Roper St. Francis, they're going to be opening up. They'll have 2,000 shots to offer here for vaccine. They will give you all the details on it. It's not just a drive up. You're going to have to register to get it done. But it is such a great relationship we have with Roper St. Francis and the opportunity to work together. And of course, the city's more than happy to be able to offer a location that's central for this to be done. So Dr. McLean, I want you to come up and explain exactly what you're doing. But again, thank you all for what you're doing every day in this battle for our community, and God bless you.
Thank you, Mr. Mayor. It's our privilege and we're ecstatic to be here today to kind of outline what we'll be doing over the next few weeks. Roper St. Francis Healthcare is moving forward in our next stage of vaccination efforts for the people of the Low Country. Since December 15th, we've been undergoing the vaccination effort to our teammates and to our healthcare providers to try to ensure the best we could that care would be able to be provided in our acute care settings and our ambulatory settings. And at the beginning of the week, the governor issued the expedition of issuing that out to the community. And so we began last week making efforts and plans to be able to roll this out on a large scale. We began looking around at our geographic footprint and where we're located, where our community is located, and we saw an obvious site here, an opportunity at the Coliseum, reached out to the mayor's team, and just happy to have the collaboration we've had with the mayor and his leadership to be able to welcome us in and give us an opportunity to set up in a central location that'll be real easy for our community to get in and out of for the vaccination effort. Just a little detail on what we're trying to do with this. This is obviously logistically a very difficult thing to think about vaccinating a large population like this. There's referenced over 100,000 Low Country residents are 70 and older, and so that's quite an undertaking that all the health systems will be trying to engage in. And so we're stepping forward and going to set up a drive-through vaccination clinic here on the Coliseum location. The way that'll work is you will have to have an appointment. I can't stress that enough, that if you just drive up and drive in and don't have an appointment, we will not be able to accommodate that. And the reasons why, not because we don't want to, but because the logistics of this are very difficult with the unknowns and the uncertainties that go into the supply chain for this vaccine and the precious nature of the vaccine, as well as the handling requirements for the Pfizer vaccine, makes everything very difficult to accommodate just walk-in service. So we will not be able to accommodate that. In order to get an appointment, you will contact your Roper St. Francis physician to get assigned an appointment slot. If you don't have an arrangement or a relationship with Roper St. Francis yet, we welcome you in. We'll get you an appointment. You can call our number 727-DOCS, and we can get you in a queue to get an appointment set. We will be doing the drive-through appointment, so you'll drive in on the International Boulevard entrance. Come around the building. We'll have drive-through lanes. You'll get your vaccine, and then we will ask that you wait in the parking lot for 15 minutes in assigned spaces so that we can monitor you for any possible side effects. I'm very happy to say that we've done almost 9,000 vaccine administrations so far and have had very little with respect to side effects. I think across the country, millions of doses have been given, and the side effects have been what we predicted and have been very minimal. And so I'm happy to say that I don't expect much problem with respect to the observation period, but nonetheless we will comply with the CDC recommendations and watch all of our patients for 15 minutes post-vaccination, and then you'll be able to exit the facility. Want to welcome in Kim Butler-Willis as well. She's does a lot of our work in the community and setting up community understanding of the vaccination effort as well as the side effects. And so we're going to be hosting an informational YouTube session next week, and Kim's going to come on and tell us a little bit more about that.
Good morning. Kim Butler-Willis, Director of Community Health for Roper St. Francis Healthcare. We know and we recognize that there are still many questions about this vaccine, and we also recognize that many people still are skeptical, especially our people of color. Medical mistrust, medical distrust is still very real, and it's very valid, but this is our opportunity at Roper St. Francis Healthcare to do it right. And so we are working together to bring together a panel of our COVID experts so that we can answer those tough questions that you have, and not just you, our greater community, but even our teammates and their families. So on Tuesday at 7:30, check out our YouTube channel, that's RSFH at YouTube, and join us for the panel conversation where we can answer the questions that you may have about the vaccine, and you can submit your questions in real time so that you can get the answers that you need in order to feel empowered to make the best healthcare decisions for you and your families. We've lost already nearly 6,000 lives here in South Carolina, and now that we have some extra tools in the toolbox, let's use it and let's make sure that we move through 2021 in the best state possible. So we hope to see you on Tuesday at 7:30.
Just to solidify the plans, we will be initiating this plan next Wednesday, so that'll be January 20th. We'll start in the morning. We'll be running weekdays for this vaccination clinic. And again, to schedule, contact your Roper St. Francis healthcare physician or 727-DOCS to get an appointment to come through the drive-thru. So again, please make the appointment before you come. We'd love to see you here. Thanks a lot.